Hello, it is now 2 p.m. Eastern Time. You have joined the JMHCP Gender Responsive Services Learning Community. To allow for additional sign-ins past the hour, we're going to get started in just a couple of minutes. Good afternoon, everyone. Thank you for joining today's JMHCP Gender Responsive Services Learning Community. My name is Felicia Lopez-Wright, and I'm a policy analyst at the Council of State Governments Justice Center. I will be facilitating today's webinar, today's session, in addition with Allison Upton from the Council of State Governments Justice Center and Becky Ney from the National Research Center on Justice Involved Women. To give you an overview of today's session, first we will do introductions and review learning community goals and expectations. Then we will review the highlights from the interest survey and have a guided discussion with Becky Ney. And then we will provide an overview of the Gender Responsive Services Resource Guide, vote on the fourth session topic, and review a resource for our next session on June 11th. I also want to review some housekeeping items before we get started officially. Everyone has been muted upon entry. However, we will be unmuting everyone during grantee introductions and during the guided discussion to allow for participation. Feel free to mute yourself at that time if you will not be speaking. The best way to get our attention during the session is to type your question into the chat box. We will try to reply to technical questions in the chat box. And for content-related questions, we actually may stop and answer them as they arise, keeping in mind our time. If we do not get to your question, don't worry, we'll keep a running list and address them after the session. We will do our best to answer your questions throughout. If you encounter technical or audio problems during the session, please call Zoom live support at 1-888-799-0125. Please understand that there are some technical issues that you may not be able to resolve. We are recording the PowerPoint slides and audio portion only of this session, and we'll send it out to all the registrants by the end of the week. And now I will turn it over to Allison to provide a brief information about JMHCP, the Council of State Governments Justice Center, and BJA.
Great, thanks so much, Felicia. So hello, everyone. I'm Allison Upton, as Felicia mentioned, and we're really excited to participate in this learning community session today and to get the chance to work with you all. We know how busy you are, particularly during these really challenging times, so we really appreciate you joining into the session today and look forward to getting to know more about you and your work, so welcome. So just to provide a quick interview of the agencies involved in the learning community on our end, so I'll start off with the agency where Felicia and I work, which is the Council of State Governments Justice Center, or CSG Justice Center for short. So you can see our mission statement here on this slide. And as an agency, we really pride ourselves on our independent, nonpartisan approach. We really make efforts to gather people from across the country and really both sides of the aisle to foster collaboration, to promote best practices and data-driven solutions. And I believe that all of you, all the different teams in the learning community today also know either Felicia or one of our other Justice Center colleagues, because each of you are working with a TA coach from our agency. So as you all know, we are also the technical assistance coaches, the agency that provides technical assistance for justice and mental health collaboration program grantees. So then the next slide. Great. Thank you. So I know you're all familiar with the Justice and Mental Health Collaboration Program, JMHCP for short, because you're all JMHCP grant awardees, of course. So on this slide, you can see really one of the overarching goals of the JMHCP. And I'm not sure if how many people are aware of this, but the Justice and Mental Health Collaboration Program actually covers a really wide array of programs that are funded with different areas of focus. But this goal that's listed here on the slide is interesting, I think, because it's really sort of represents the common thread amongst all the JMHCP grantees. One of the common threads, really the essence of what you're hoping to achieve through your grant-related work with this particular target population at this intersection of behavioral health and criminal justice systems. And actually, I think this learning community in particular is one of the innovative approaches or strategies that is here to help support your work with participants, and it's actually directly funded through the JMHCP. Okay, if we can go to the next slide then.
Oh my God,
great, thank you. So this next slide, I know you're also all familiar with the Bureau of Justice Assistance, or BJA for short. You could read their mission statement here. And you probably also know that within BJA, it's the Office of Justice Programs that directly oversees the JMHCP, the Justice and Mental Health Collaboration Program. So really want to mention them here because we're so grateful for their support and their funding. It's through their support that we are actually able to hold these learning communities such as the one we're having today just for grantees. So we appreciate their support. Okay, and we can move on then to the next slide. Great. So we just wanted to start off with some introductions on our end. So I can take a start at that. So my name is, as I said, Allison Upton. I work for the Council of State Governments Justice Center. I'm a project manager here, and I've been with the Justice Center for about 4 years now. And Becky, correct me if I'm wrong, but I believe this is at least the third year. This is probably, I think, the third year that we have had the opportunity. Yeah. To hold this, the Gender Responsive Services Learning Community. So it's really great to see that work, growing and continuing on. And my background training-wise is as a clinical psychologist, so I've worked in that arena for many years before coming to the Justice Center. And I just wanted to quickly say that that's actually how in my prior position, is how I became interested in this topic of working with women with justice involvement and learning more about gender responsive services. And I'm based out of New York City, and so before coming to the Justice Center, my most recent position was at a local alternative to incarceration agency here in New York City, and we actually were JMHCP grantees ourselves. So I know that experience, the experience from that side as well, and we had the great opportunity to use our funding to start a pretrial diversion program for women here in New York City who were facing misdemeanor charges, to try to divert them from arraignments in New York City and get them connected into services and supports in the community. So that really whet my appetite for learning more about gender responsive services, and I feel so grateful that I've been able to participate in these learning communities since then. So I'm really excited to get to know you all and to know more about your work, and I'll turn it over to Felicia to go ahead with the introductions.
Thanks, Allison. As I said before, my name is Felicia Lopez-Wright. I'm a policy analyst within the Behavioral Health Division at the Council of State Governments Justice Center, and I am a licensed clinical social worker. So prior to joining the Justice Center, I actually provided outpatient mental health therapy to children, youth, and adults. And I became passionate about gender responsive services actually during my undergrad career. So this is definitely a topic of interest of mine, and I'm so excited to be able to meet all of you and work with all of you during this learning community. Thanks. Becky?
I'm Becky Ney. I'm the director of the National Resource Center on Justice Involved Women. We'll give you our website address later. Our primary objective is to provide resources to those of you who are professionals, practitioners, working with justice involved women. I'm also a principal at the Center for Effective Public Policy, which is a nonprofit that has specialized in criminal justice reform. We do work in a wide array of corrections, primarily corrections and criminal justice topics, including pretrial work, including probation and parole violations, working in facilities, especially women's facilities, doing a lot of parole work. And so we run several national resource centers that were originally started with BJA, but now are on their own, that really provide training and technical assistance and resources for the field. So just a word about the Resource Center. I'm going to move very quickly. There have been several partners, and they are listed there. I'm not going to state them all. As I said, our primary job is to provide resources and tools to professionals. So that can mean that we take the research and we distill it down and put it in some practical terms. We make folks aware of statistical information and resources and tools that can assist them. Let's carry on. So you'll get these this PowerPoint at some point, and you can just click on the Resource Center website if you are interested. If you haven't heard of the Resource Center, we have a number of project resources that we've developed on our own, as well as trying to keep resources that are from other sources as well. Next one. Just our goals. Again, at the risk of being redundant, to promote innovative, evidence-based, trauma-informed, gender-responsive approaches. This often means working to address women's strengths and to address their risk and needs, which are quite different from men. I expect many of you already know that. To promote policy and management practices, to highlight critical issues. We're going to talk a little bit about one of those issues a little later on today, and to build a community of professionals, all of you and many others who are very interested in working with women in more effective ways. Ultimately, our goal is to reduce the number of women who are involved in criminal justice.
Great, thanks, Becky. I'm sorry, did you have something else to ask?
Nope, I'm good.
Okay, great. So moving right along, here you see the overall goals for this specific learning community on gender responsive services. So overall, we hope that you learn from each other as JMHCP grantees. We aim to provide you with information on evidence-based practices and principles regarding being gender responsive in your system, and to facilitate your access to our national expert partner that you just heard from, Becky Ney. And here are some expectations that we have of you as participants, and also that you will have of us as facilitators. So overall, there are a total of 4 learning community sessions, which you should have received meeting invites for via Outlook. We expect each grantee team to attend and participate in each session. This opportunity overall is going to be what we make it, meaning that the more that you participate and engage with us, the more that we will learn and get the best out of this learning community. We made the decision to use Zoom to further foster that increased interaction and discussion. And if you feel comfortable, feel free, like us, to also turn on your Zoom video to enhance communication. We also chose Zoom, not to keep promoting Zoom, but we also chose Zoom to allow these sessions to feel more like a learning community versus a webinar. And in between sessions, you can expect emails from myself, Allison, and Becky regarding relevant resources, questions to consider between sessions, and any other activities that may be of relevance. So now we're going to move into brief grantee team introductions. Each grant team should have chosen a spokesperson to introduce themselves and their role on the project, introduce any team members that you have in attendance with you, and to also share one thing that you would like everyone here to know about your grant project or team. If you would like to actually read more about any particular grant program in attendance today, you can refer to the list of participating grantees that you should have received that was attached to today's Outlook invite. So this slide and the following slide has a list of all participating grantees in this learning community listed in alphabetical order. So this is the list that we're going to use today to go through round robin and have introductions of each grantee team. We will now unmute everyone. So please mute yourself if you are not speaking for your team. You are unmuted. Okay, I think everyone's unmuted now. So first, we're going to begin with Bexar County, Texas. I hope I'm pronouncing that correctly. So if anyone from Bexar, oh, okay, great. So go right ahead and introduce yourself, your team, and anything you want to share.
Right. My name's Kathy Johnston. I'm the case manager for our team. There is no one else on the learning class today. Everybody else is actually in court. So I don't know if you want me to go through everybody that's on the team, or I didn't understand because the question on that.
Yeah, it was more related to who was going to participate in this learning community, but if that's something that you wanted to share about your grant in particular, it's up to you.
It doesn't matter. Like I said, I'm the only one here. We do have a wide range of team members, and we have actually, one of the little tidbits is we actually won the award for the best specialty court in the country. So that was quite special.
Wow.
On our team. So the one thing that, another thing I'd like for you to know about our team is that 100% of our clientele receive mental health service through our Center for Healthcare Services with a licensed mental health provider. So that's something that's
wow.
really amazing for us, that we are able to live in a county that supports that. So that's all I got.
Exactly. Thank you. Thank you,
We also
Kathy.
love your background.
That's great.
Your background is great. It's making us think of tropical.
Thank you. I'm working from
Very
home.
uplifting. We love it.
Great. Thank you so much, Kathy. Moving right along to Bureau, if there's anyone from Bureau County, Illinois on today.
I believe Bureau County was unable to join.
Okay.
Am I correct? I believe.
I think so. Just double checking if anyone maybe was able
They
to.
planned to participate, but they had an urgent situation today they had to attend to, so.
Okay, understood. So number 3 is Marion County Sheriff's Office in Indiana. So anyone from Marion County, if you would like to introduce yourself and your team and share one thing about your grant program.
I think the person that we thought would be here is Callan Carr, if I'm saying it correctly, the project director. Not sure if Callan is on the, I don't see the name, but. Well, I'll tell you what, why don't we move on and we can try to come back to Marion County and see if someone joins in.
Mm-hmm. Fantastic. Okay, next is Newcastle County in Delaware.
Officer Kearns, Newcastle County Police. Our whole team is actually on, so we have Lieutenant Al Herring, Officer Omar George, and Social Worker Alex Schofield. So we're co-responding response to 911 calls where a social worker respond out with a police officer to help either divert from jail.
I'm sorry. I'm sorry to cut you off. You're breaking up, and I can't hear you. I'm very sorry. I'm not sure if it's just me.
No, it sounds a little bit scratchy. I think you said that your officer, George, is that correct? Yes, and that Lieutenant Herring and Alexander Schofield are also on the line? Also on the
Yeah, so maybe one of them want to take it.
Yeah, hi, this is Alex Schofield. I'm the social worker. Can you guys hear me?
Yeah.
Oh, yeah.
Sorry.
Yeah.
Oh, yeah. I'm sorry. Am I too loud now? You're getting the best of
No.
both worlds. So that was Officer Kearns who just spoke. On the line, we have our entire team. It is Officer Kearns. We have Officer George, Lieutenant Herring, and myself. We make up the unit from Newcastle County. We are the crisis intervention and response. We do the co-responder model. So we have myself as a social worker. I'm partnered up with an officer, and we go out and respond to emergencies and advocate for people out in the community and do outreach and do all sorts of different interventions to keep members of the community in the community.
Wow. You're doing great work, all of you. Thank you, Alex.
Thank you.
I just will say, I don't know if you were joining, if Officer Kearns was joining by phone. I don't know if it would help at all to dial, you know how they give you a whole list of numbers when you dial in? Maybe if you try a different number, maybe that might work better. I'm not sure, but just throw that out there.
Okay. Thank you.
Worth a shot. Okay, great. So we're moving next to New York State Unified Court System in Buffalo, New York.
Hi, it's Alicia Tabliago here. How are you?
Hi, good. How are you?
Good. So I'm the resource coordinator for the Human Trafficking Intervention Court here in Buffalo. We are a hub court for all of Western New York. So 7 counties, 7 surrounding counties. Our team members, they were on briefly, but they had to jump off for other meetings. But that would be a treatment provider through Evergreen Health, and also evaluation services through Via Evaluation. So what our grant consists of is we were seeing mainly females, but we're actually trying to access males and more transgender communities. So this is actually a really good training for us along with the trauma. We were seeing people come through. They were getting to the point of feeling comfortable and safe, and then getting to a point where they were disclosing a lot of information, either safety issues or trauma history. And my background is in mainly sexual assault work in the past with either law enforcement or through the Rape Crisis Center. And so I felt comfortable getting to a certain point, but I also felt like we're not doing a service to them if we don't have a trauma-trained clinician on staff. We were referring them out to agencies out and about, and one in particular was doing a fantastic job, which is Evergreen Health, on working with them on the trauma. But there was a gap between them when they left our court and they would actually show up to these sessions, and we were really having a hard time with that. How do we bridge that gap? So when the grant came out, we thought, what if we provided a trauma clinician on site in the court to sort of do a warm handoff and then continue that on, and also do kind of crisis intervention if needed, because a lot of people do experience that as well. And then the other half of our grant is sustainability. We were finding that there was a lot of providers in our area who really meant well and are doing a lot of work in the substance use and mental health field, but there was just not enough of the trauma-informed kind of approach that was going on from start to finish. And some didn't have the capacity and some were doing well, but I think across the board it wasn't really consistent. So what we wanted to do is the other half is sustainability, is train local providers on what that really looks like. Everything from the waiting room to when you kind of close out with a client, what does that look like? And everything in between, and how that kind of approach with people who have been through trauma, how that really affects them. So it is a court-based kind of model right now. I mean, it's a court-based kind of grant, but it's really, we're trying to add more of the trauma piece into the court setting and attack that in the forefront.
Wow. Awesome. Thank you, Alicia, for providing that overview. And it sounds fantastic that you all are addressing those barriers and being comprehensive in how you're responding to the clients that you're seeing.
Yeah, we're looking forward to it. Thank you.
Oh, awesome. And happy that this learning community fits into some of those goals.
Yeah, it really does. Thank you.
Fantastic. Take advantage.
I will
All
definitely.
Right,
Thank you.
You're welcome. Next, we have another New York State Unified Court System in Rochester, New York. So anyone from that team, if you want to get started?
Let me unmute myself. I think I'm there. I'm Angela Stephanie. I'm the case manager for the Human Trafficking Court in Rochester. I think I might be the only one on the call today, at least. Hopefully we'll have more join in the future conversations. But I think just an important thing to share about the opportunity of this grant is that Rochester Human Trafficking Intervention Court has actually been operating since 2013. Essentially, no resources, relying solely on the volunteer support of the community. So with the opportunity of this grant to hire dedicated staff and partner with Rochester Regional Health, we'll be better able to address the mental health, substance abuse, and trauma-related needs of the justice-involved trafficking victims that we serve. The grant has also going to allow us the opportunity to expand across the county versus just the city of Rochester, so we expect it to make a significant impact on the population that we serve.
Great.
And this is that.
Thank you.
Yes, I was curious. Could you just say the year that you started? Because it faded out a little bit when you said the year. I was just curious how long you've been running.
2013.
Great. Wow. Thank you so much.
Yes. Thank you. Keep up the good work. All right. Moving right along, we have Palm Beach County Sheriff's Office in Florida.
I think they may know who you are, Felicia.
Yeah, I think so.
Felicia's their TA coach. Felicia's their TA coach.
Can you hear me?
Yeah.
Oh, okay.
Hi,
okay.
Danielle.
Hi there. So my name is Danielle Willette. I am the grant project coordinator and also on our team here in Palm Beach County. We have Dr. Jenna Rollins, who is our grant manager. We also have Lieutenant Randy Foley. He is the project director, the commander of the Behavioral Services and Threat Assessment Unit. We also have Dr. Cassandra Atkin-Plunk and Dr. Vaughn Kirchlow. They are our project evaluator partners through Florida Atlantic University. So just to give you an overall of our program, we're a multifaceted program. Our overarching goal is to prevent school and community acts of violence. We also would like to achieve, to achieve this, we have partnered with community stakeholders through a formalized committee, which is focused on increasing public awareness around identifying and reporting threats, and also on promoting available community services for individuals who are experiencing challenges or maybe needing just additional supports, that can be related to mental health services and or substance abuse disorder services. Another prong to this project is fortifying our behavioral services unit, which the inception was in 2014. So it's based on, it's a threat assessment team of law enforcement officers and licensed therapists working side by side to identify and address community threats through assessment and intervention. And also, having additional trainings for identification and utilization of validated assessment tools, and increased coordination with our law enforcement and community partners. So, we're identifying and responding to threats in the community, and our partners are tasked with addressing the behavioral health needs and other needs of individuals that are identified through this process.
Great. Thank you for providing that for everyone here, Danielle. As Allison mentioned, I am your TEA coach, so I'm familiar with your program, but I think your program definitely highlights the variety of grant projects that we get under Category 3 JMHCP grants. So thank you so much for joining this learning community.
I also, I know there's a few of us on the line. I know that Lieutenant Foley's on the line, and I didn't know if he would like to add anything to the introduction. Okay, maybe not.
Maybe later.
Sure.
Okay.
Maybe anytime. You could, yeah, love to hear from him as well.
Yeah, no problem. Next, we have Richmond Behavioral Health Authority in Virginia.
Hi, this is Dawn Farrell-Moore, and I'm on the phone or on Zoom with two of our teammates, Brittany Cox and Lauren Stevens, and we're representing our BHA, which is the clinical provider of our Circuit Court Behavioral Health Docket. That's specifically what our funding right now is for. We're still in our planning phase, so we're pretty new. We've had the grant less than a year. We haven't hired our new clinicians quite yet, but we are planning with our court partners and looking forward to this learning collaborative to help us, especially in these planning stages. We work with a good mix of male and female. I think it's about 60-40. We are familiar with some trauma-informed care learning collaboratives. We participated in one last year. So we're looking forward to learning from this one and sharing news with not only this docket, but we also have a general district court mental health docket. We have an adult drug court. So we have a lot of involvement with criminal justice in our community. And just know that this is going to help. You kind of got our feelers in a few different places. So we're going to share the knowledge with everyone.
It's great. We have a few evaluators on the learning community too, so we welcome the diversity in terms of the disciplines that are represented. And I just wanted to, you mentioned being in the planning phase, and I just wanted to let everyone in the session today know you're not alone. We have lots of grantees that are, early in their grant awards, so they are also in the planning phase. There's some that are farther along in implementation, so it's fine. We can all learn from each other, I'm sure.
Great. Thank you.
Yeah.
Thank you, Dawn. Appreciate it. And welcome. Next, we have Sonoma County Probation Department in California.
Yeah, hi, this is Allison Lobb. I'm the project coordinator. We are we have a pretrial program. We've just are into our expansion grant, so we're into year 4 of this project, and we were able to add a transitional housing bed, and it is co-ed when we can manage it. I have to say that COVID has thrown a wrench in a lot of things. I'm sure we're not alone with our project with that. And one of the things that I'm really proud of is we have an extensive implementation team, about over a dozen people on it, maybe 13, 14, cross-disciplinary. So we have community providers and different agencies involved, and we have 2 peer consumers on board. I'm really thrilled to have 2, and one of them is a woman, and she's also a member of the LGBT community. So I feel like she's gonna be able to provide us with a lot of support in focusing on the different types of needs of women. And I'm really sorry, I have to jump off until noon for another call that I have to be on, but I will rejoin at noon, and I'm sorry to be missing some of this program today.
Allison,
No.
it's great to see you face to face.
Yeah.
So we'll have to, I've worked with Allison previously, so we're happy to have you back when you can join. We appreciate you making the effort to come on today.
Thank you so much.
Thank you.
See you again soon.
No problem. Great. And next we have South Carolina Department of Corrections in South Carolina. Anyone from that team want to take the lead in introducing?
This is Dr. Brittany Soto. I am the psychologist that works with the female population in South Carolina. We have 2 female institutions in the whole entire state, and this grant is a project along with the Department of Mental Health in South Carolina. The goal is to provide evidence-based trauma care both while the females are incarcerated for, I believe it's 6 months while they're incarcerated and then 6 months while they are home. So they will continue their care once they are home. And this will also include parent training once they are home to help them re-enter society and reform positive relationships with their children.
So excited to have you. Thank you. I'm so happy that this grant project was able to join as well. I know you all are early in your planning phases as well, so I'm glad that you're able to take advantage of this learning community, especially given how women-focused your grant project is.
Thank you.
Thanks.
And this is a great topic too, right? That women we know are more likely to be the primary caretakers, right, of their children, women in custody, compared to their male counterparts. So this is great that this is, a focused part of your grant project.
Mm-hmm. All right, so moving on to Village of Orland Park Police Department in Illinois.
So I'm Bonnie Hassan. I am with Trinity Services Counseling Center. I'm the Director of Outpatient Mental Health Services. And I'm also the program manager for our grants. We are also in the planning phase still right now. We've been a referral source for the Orland Park Police Department and Village for about 3 years, and this grant is going to help us to expand, develop a mobile crisis response unit, and also serve 5 additional communities that are in the surrounding area. And yeah, we're just really excited to take part of this. And kind of what you were just saying about women having multiple roles. I'm also teacher and mom today, and I'm on the floor in a playroom. So I'm gonna possibly have to shut my video off again if it starts breaking up.
No worries. New normal. Yeah, new normal. We're all at home. We're all dealing with a lot of different priorities. So we appreciate you joining, Bonnie. Great. Next, we have Warren County Sheriff's Office in Kentucky.
Yeah, this is Dr. Ben Stickle, and representing the Sheriff's Department today. So I actually teach at Middle Tennessee State University, and we've partnered with the Sheriff's Department to help them with their planning. And I serve as the subject matter expert, as you will, and the scientific consultant. Kind of a unique aspect is formerly actually worked for the Sheriff's Department as a deputy for a number of years, and then moved on to academia, was able to circle back around and provide some assistance for him. On with me today is Dr. Mitch Miller, University of North Florida and a CJS faculty fellow, I'm sorry. And he's primarily working as the evaluator and some of the data collection and management. Some of the things that we're really, interested in is building out some of the screening that we're currently doing, needing to serve both men and women, but looking to try and get some screening for women that would allow us to enhance the connections we have with some of the services that are already there. And the one thing I guess I would share that we're really is a particular challenge for our organization is if there's any in treatment that needs to be done rather than outpatient, it's like a 3-hour round trip to take them to get treatment, which causes a great amount of stress, especially among our female population if they have to leave families and things like that. So we're really looking for some tools to help us respond to that as well. So thank you very much for having us today.
Thank you, Dr. Stickle. We're glad to have you.
Yeah,
I'm
really
happy
glad
that you're
to have you.
you're able to join.
Yeah, and we're gonna, I'm taking some notes as we go about interest. So we're really glad that you raised interest that you'd like to explore in this learning community. We're gonna have some more time as we go through the session today for folks to share particular topics, because we really want to take your ideas and try to, of course, incorporate them throughout the session. So thank you for that, and we'll talk more about that as we go forward.
Yes, thanks for raising that early. Great.
Yeah.
And next, last but not least, we have Yolo County District Attorney's Office in California.
Hello, everyone. My name is Preston Schaub. I am a prosecutor, deputy district attorney for Yolo County. I am joined on the call by Joseph Goki, who's one of our public defenders, Christy Abbott, who's one of our supervising clinicians with the Health and Human Services Agency, and Jasmine Gonzalez, who is the probation officer for Yolo County assigned to the mental health court team. We also have an accompanying addiction intervention court team as well that's sort of another arm of the same program. We are a collaborative court, meaning that the probation department, the court, the district attorney's office, public defenders, and Health and Human Services all work together to identify individuals that come through the criminal justice system that have serious mental illness and a nexus between that illness and the criminality that they're engaging in. When we identify those people, the probation department in HHSA does assessments to determine whether or not they would be an appropriate fit for our program. We try to focus on those individuals with a higher level of need. We have other programs available in our county to address individuals that don't require that level of care intervention. Once we've identified a participant who is appropriate, we all meet as a team. We make a decision on whether or not they are a good fit, and if accepted into the program, then they begin a process in which they come to court, they meet with the judge, we do updates with them, we engage with them, we develop treatment plans and exit strategies for when they're ready to join the community again. And we pride ourselves on having sort of a team effort in this, and it's a refreshing change of pace in the normal adversarial side of our system. Something that's cool about our program is when COVID-19 pandemic hit, we did a great job of continuing our assessments and other evaluations through Zoom, and we're even still running our court through Zoom as well right now in order to try to minimize the impact on our participants. I think we are one of 2 counties in the state that was able to pretty seamlessly continue on with the work in spite of these awkward situations. We've been operating for a few years now. We're getting pretty good at it. So if anyone has questions on how to implement their programs and get their things running, I think we have some institutional knowledge that might prove helpful for everybody. So thanks for the opportunity. We look forward to working with all of you.
Oh, you're welcome. Thank you, Preston, for providing that overview, and also a lifeline per se for other folks that may be in the planning stages of their mental health court programs. And yes, one of the positives of this pandemic is that everyone's so used to being on video and talking to a camera or to their computer. So I think it's definitely to our advantage for this learning community right now that we're taking this platform. We appreciate your participation. I do want to go back to make sure that if there's anyone from Marion County that maybe joins later that wants to go ahead and introduce their program. Okay, I don't hear anyone, so maybe we'll have them introduce themselves on session number 2. Thank you everyone so much for the detailed introductions and for providing all those tidbits about your programs and also other areas that would be helpful to learn about during this learning community. Great. I think we're going to mute everyone again now, and you'll be unmuted again later on during discussion. Okay, so now we're going to move on to shifting over to an overview of the interest survey, highlights, and a guided discussion with Becky Ney. Okay, so here we have an overview of the highlights from the interest survey regarding which areas that you were interested in this learning community and also what goals you had. So some of you identified a need to learn more about establishing gender responsive approaches or improving your existing response, providing successful services to the increasing number of women with criminal justice involvement in your larger criminal justice system, embedding a gender-responsive approach in your criminal justice programs, addressing challenges with addressing women's unique needs, training your police officers on the interplay between gender, mental health, and criminal justice, and providing better engagement strategies to divert women from arrest and also make sure that they're not ignored in any outreach efforts. So we're really looking forward to hearing more about what you want to accomplish from this learning community, and we'll have more time for that shortly. I'm actually going to hand it over now to Becky to continue with the discussion questions.
Thanks. We're going to do the poll first.
Yeah, I think we can start with the poll.
Let's start with the poll. One of the things that, so we're ending up talking a lot more on this first webinar because there are things we need to introduce and get out of the way. But we're really planning to have some discussion now. And one of the things that would be helpful to us is to get a sense about how you would rate your knowledge, all your team members. So if you could just click on whether you believe you're a beginner in terms of understanding gender responsive services, intermediate or advanced, that would be really helpful. So we don't either bore you all because you're all advanced folks who are knowledgeable or go way too advanced. So I expect we'll see a spectrum, but let's just take a moment and everyone can click on a response. And I believe you have to then, once you hit a response, just hit submit at the bottom.
Right, and just to note too that you're responding anonymously, so it's not connected to your name.
And I'm thinking we should unmute everyone at this point as well.
You are unmuted.
Great. All right.
You are muted.
All right. So can we share the poll result?
And anyone who's not speaking, if you can mute yourself so the feedback kind of decreases.
Okay, that's a good idea. If folks can self-mute themselves with by going down to the left-hand corner, and then if you want to jump in and talk, that'd be great. Get the background.
Yeah.
All right, so we have some folks who are novices, a lot of folks kind of in the middle, and some who are also advanced, and I expect those are the grantees who have been working with women for quite a while, and probably more than all of us. So their end is sort of one of the primary goals of the learning community. I don't pretend to be an expert. I know a little about a lot of things, or a lot about a few things as well. But I think we have the opportunity to really learn from each other. And so I just wanted to start off by having a brief conversation here about a couple of things. And, one being sort of, what do you think you're doing well? I mean, so this is kind of the pros and cons, right? What are you doing well? And what's been most challenging to you? And this is all with respect to working with women and implementing gender responsive approaches or planning for them.
Sorry, I couldn't quite hear you.
So folks can just sort of jump in, please.
I can start. This is Dr. Soto from SCDC.
Thanks.
One thing that I think we struggle with in my corrections is getting the officers on board to understand gender responsive treatment and language. Surprisingly, we're finding that the female prisons are more punitive than the male counterparts. Yeah. So I think bringing all of this back might help, because then maybe we can start going on the right track.
Right. So a big challenge, yes, not a surprising one. It's a fairly common challenge inside facilities, but I imagine a common theme that's going to run throughout all the grantees, as we saw on the initial slide that Felicia put up in terms of training officers. And I think that's true. You and I should have a side conversation, or I'll fill Allison in. I had the opportunity to be on site for a whole week and assess both of your female facilities. I'm going to say maybe 5 years ago or so. So I might be able to share some thoughts about that. But yes, I think it's important that we not only have kind of the clinicians, the experts, the psychologists, the folks who are most knowledgeable about trauma, but when you think about a prison or even on the street for a law enforcement officer or a court, it's often the correctional officers, the line staff, the police officers who have the most contact with women. So, so a good one, a good challenge. Others?
I can go ahead. It's Alicia Tabliago from Human Trafficking Court in Buffalo. Ours is sort of the opposite. I think people are so focused on females, being that it's a prostitution kind of charge that may bring them in. But we accept cases of all different charges, and our referral base is mainly law enforcement and the DA's office or public defenders and outside organizations. And a lot of the organizations we work with are very geared towards recognizing males as victims as well. But it's a lot of the rest of the population that may make referrals and may not actually exclude anyone, but may not recognize cases or respond to red flags for males as quickly as they would for a female. So that's, I feel like we're doing well. In some ways, we're educating ourselves so much, but we're not seeing the referrals coming in, and we know those cases are out there.
Sure. Okay. And I guess just an aside, I think a lot of the things we will talk about through the course of this learning community, and especially in terms of trauma, are that they are as applicable to men as they are for women. I think when it comes to gender responsive things, I think we can respond to men in a gender specific way as we would with women. So those principles hold true. I think just the response maybe looks a little different whether you're a man or a woman. So yeah. Others? Things working well, things that are going to be a big challenge for you. We've heard a couple of them already.
I think this is Alex Schofield with the Newcastle County Police. I think things that are working well for our unit is the fact that we're lucky enough to have Officer Kern. She also has her MSW, and she has been with the program from the beginning. So we've been very fortunate to kind of have somebody who can see both sides of the coin and understands from the co-responder perspective how important gender responsive approaches are and how to implement that in an officer friendly way. We are currently working on a presentation to give during roll calls specifically on this population for female offenders. So there is a lot of good information getting out there specific to this. And everybody so far that I've worked with as a mental health professional within the police department has just been very receptive to gaining this information and utilizing it in the best way possible.
Great. Good. Good to hear. So I hope we will hear some more about some of those, how you are implementing some of that in the roll call. You will have seen when you saw the list of grantees that there are a few of you working on crisis approaches, and then there are those of you working through the court system, and then some others in corrections. So, so good. Others want to chime in?
This is Danielle from Palm Beach County Sheriff's Office. I'd like to say in Palm Beach County, we have reentry programs, and being that we have seen the influx in female incarceration, Palm Beach County itself, stakeholders have really put a lot of emphasis into female gender responsiveness with, reentry services. So we work very closely with our main detention center, our corrections, and so it's a nice warm handoff, so to speak, with our community providers.
Great, good, okay. So I heard a couple of you talk about having learned that kind of a warm handoff makes a lot of sense. Are others of you sort of thinking about how best to do that? Or any experiences in passing folks off? Bad use of term, but you know what I mean?
This is Dawn. I'll just chime in about warm handoffs and what we've done with some of our projects and hope to implement with this behavioral health docket is to incorporate peers, recovery peers, into the handoff process. And that's folks that will work both with the court and the clinicians and the criminal justice team, but also with the behavioral health team. A lot of our services are provided by our local community services board, and it's easy, in that move over to kind of sometimes get lost in the cracks. And so we have found that peers are very helpful with staying engaged and increasing motivation of the participants and knowing what's available in the community and being able to, make those connections for them pretty quickly.
Great. I'm glad you raised that issue again about peer support, because I have found my work with women that peers are really important. Mentors, peers, someone that's there for her, and has been really, really helpful to the women wherever they're coming from.
Yeah, we incorporate peers in just about all of our services, residential, outpatient, the gamut. Mm-hmm.
Right, that's great, great. Yeah, and I find I don't have a lot of research on it, but I anecdotally at least, I find that women respond better to mentors than men do. Maybe that's a biased perspective, but I've certainly found that the women especially, because perhaps we're relational, we'll talk about relational kind of the next time. The women are relational. They need to know they can trust you. They need to have somebody in their corner that they know understands them and has been where they have come from. So I think the relationships for the women are particularly important.
Yeah, I agree.
Great, great. Anyone else? Others? I have written some things when you were doing introductions about some challenges and some things you're hoping to get out of these grants that talk about sustainability. So we do plan to address that on one of the webinars, so that's a good thing. Assessments. So I expect that some of you who have been in the crisis response business for a while have utilized some tools that you like, and so perhaps we would have an opportunity to talk a little bit about some of those, although probably not today. I have training. I have trauma. Trauma came up a couple of times, and we should talk a little bit about what that means. How advanced, or I kind of heard a wide spectrum of, we need to figure out how to get someone here who has a trauma training background, to we need to be more advanced in how we are dealing with disclosure, and some other things. So we might talk a little bit more about that. And then diversion and outreach I heard about as well. Also reducing the number of women. I think in the crisis intervention projects and the pretrial project in California, certainly in the very beginning of the system, there are opportunities, and perhaps in the courts as well, opportunities to divert women to services. What we find is that women do very well in the community, not necessarily having to be further pulled into criminal justice. with a lot of support. Because they are typically nonviolent, charged with nonviolent offenses, typically lower risk, but lots of needs. So I think we can talk some more about how we can address the increasing number of women in our systems, which is kind of skyrocketing everywhere in the country right now. Any last thoughts or other thoughts here before we move on?
Becky, this is, I just also wanted to add that maybe this is partly what you covered already, but folks are talking about engagement, wanting to know more about engagement strategies for women. I think we definitely have resources on that. We can talk about it also, but we have some existing resources from our earlier learning community session, et cetera. But also, it seems like not only engaging the women themselves, but engaging team members, you know, on why this is a great issue to work on, how to maybe try some different strategies, you know, to open up your toolkit with how you can, you know, work with women, right? You know, we heard from South Carolina about how it's hard to get the officers on board sometimes. You know, it seems more of a punitive stance in their case sometimes. You know, also just maybe others are, you know, busy and just don't necessarily see the big impact that you can make. So I'm wondering too if that links into some of the ideas we thought to focus on in our next session too, around rule breaking, because I wonder the interaction there and how women might present in certain scenarios, and that impacts how people react to them, right? So, and back and forth. So I just mentioned that.
On my list. Great, thanks. All right, so let's move on so we can stick to our time frame here today. So in the second round of the learning community, I developed a little resource guide for grantees who are in similar position as you are. I think you all received a final draft of that. So I just want to talk a few minutes about what that is, and then we'll turn our attention to what's to come. Okay. So this is just a little resource guide that I just have pulled some very basic information resources from various publications that we've done for the purposes of this grant program. So let me tell you a little bit about what's in it. Go to the next one. So I know you may be in the beginning of planning, or you may be in the beginning of planning for implementation, or maybe you're a little further along and you've already started thinking about how can we sustain this program once the grant money goes away. And so, well, and not only that, but how can we influence how others respond to women, maybe not in our specific program, because often we find, I'm sorry, I'm picking on South Carolina today, but we find that even when we can have really excellent programs and we can train staff, what happens is that women have this experience of going to trauma-informed and gender-responsive programs. They really get a lot out of it, but then they go back to the cell block where folks are not necessarily engaged in that. And I think that's true in other systems as well. So it may be that the crisis intervention team has a lot of training and they're working together and they really get it, but maybe not the entire police force. Maybe some pretrial workers or some probation officers are really attuned to women's issues, but not everybody. So how do you think about how to begin to spread out a little bit, so to speak? Because we can do our best work in the programs that we have, but the women are experiencing and coming in contact with lots of different things in the community that may sort of do in or make more difficult her movement towards success. So think about some ways in which you can begin to build strategic partnerships with stakeholders. I would say with funders. I would say with others who might have some interest in what you're doing. Consider how this program fits in a larger criminal justice system. Again, in one courtroom, there might be a really very different experience than what's being experienced in a mental health or a human trafficking court. There are some tools, you're probably familiar with them. You could do a SWOT analysis as a team. So identifying literally the strengths, weaknesses, opportunities, and threats to your program, and then developing some strategies to use your strengths and opportunities to address weaknesses and threats. The National Institute of Corrections has many resources on women offenders and gender responsive and trauma-informed policies and practices. One is called the GRIPA, the Gender Responsive Policy and Practice Assessment. You can go to the NIC, the National Institute of Corrections website. They are a federal justice agency, and download it. It's I believe it's made to work electronically. And again, as a team, you could walk through that and see where your strengths and gaps might be with respect to responding to women in your system. You could do a system map. I think many of you have done a SIM mapping, probably. You might consider doing a flow chart of your criminal justice system and just see, do women flow through your system in the same way as the men? What kind of strategies have you put in place or plan to put in place? And how's that going to impact the rest of the system? Again, in terms of success and sustainability, I think you want to tell your story. I think there's just some really incredible stories out there that the women tell, that you can tell, that the women can tell, and that you can communicate. So doing those things, I think, are part of kind of larger change strategies and helping to sustain your program beyond grant funding. Let's go to the next one. Also in the resource guide are just some basic facts about women. And just, you all probably know this, women are the fastest growing justice population in the country, despite the fact that we have been closing prisons in some states, reducing male populations. The women's population is continuing to rise in many states, not all. And that's having a big effect at the local level, especially in jails. And yet women are largely nonviolent and low risk, as I said before. We know that women come into criminal justice, for example, in a very different way than men do. Often we see kind of this cycle of trauma and abuse, poverty, substance abuse. I mean, we haven't talked about drugs, right? I wonder how many of you are dealing with co-occurring disorders and significant drug problems of women as well. I work in one state where they have a huge methamphetamine problem among the women, and they have some legislation that makes it hard for them not to lock women up simply for using. So they are trying to do some programming to address that. But you all know better than I, those of you who are clinicians, how difficult it is to sort of address those kind of addiction problems. And then unpack all the other issues of trauma and abuse and everything else. So some quick facts are in that guide. Let's go to the next one. We're going to talk on the next webinar a lot about relationships. And I'll talk about that in a minute, but understanding that women are relational is really important. It's a possible, not the only, but possible explanation for why, again, I promise I won't pick on South Carolina on the next webinar. In my experience, what this means in corrections is that women are always asking questions. Why? They're trying to establish a relationship and establish trust. Often we say that, men in the same situation, if asked to do something, will say yes or no. And she says, why? So often we find women have lengthy disciplinary and sanctions in correctional facilities and in jails, but for relatively minor things like disobeying an order or being out of place or trying to help out a friend by providing extra from the chow hall or whatever it is. And I expect you'll find those things or surely are already finding those things. So we want to talk about what that means in terms of how we engage. There's also some research findings in this guide about gender responsive and trauma informed approaches, all of which is about trying to get better outcomes with women. Let's go to the next one. And then we have kind of like a core, if you will, about assessment programs and case management strategies. So there is a listing of what we know about gender responsive risk and needs assessment tools that are evidence-based. There is a listing of research-based gender responsive and trauma-informed programs as well within the guide. And then there's a discussion about a collaborative case management process, of which it sounds like many of you are already engaged in, even though you may not call it formally collaborative case management for women, but you are, as I have heard you talk, implementing many aspects of that. And partly, I think I just would say one more word about collaborative case management is what we know about women is that because they can be complex and have a myriad of issues and needs, we need to respond to them in holistic and collaborative ways. I think you all have, sounds like you all have figured that out. So we can't just send her to, say, a substance abuse treatment program and then send her off to sort of trauma, mental health counseling without folks sort of talking about and understanding how these issues sort of present themselves and play out in each of those areas. So I think you all have figured out some of those things already. And let's go to the next one. And lastly, of course, there's resources. These are just a couple of the resources. You will find these on the National Resource Center for Justice Involved Women website. There are other ones there. I refer you to the Trauma Informed Practices brief because there's a listing of some very practical ways in which you can be trauma informed. It says security in women's facilities, you know, substitute women's facilities for probation office, pretrial services, mental health court, etc. I think they would be relevant to you. If you're interested in some of the factual information, want to read further, we have a brief called 10 Truths That Matter. There's a short brief and then there's a much longer one that highlights all the research. I know because I just talked about communications and some of you are interested in talking about what you're doing. We have a sort of a toolkit. I know CSG probably has a communications toolkit as well. You said you wanted to talk about outreach and educating others, and so maybe there would be some guidance there that would be helpful. So it's just a smattering, if you will, a smattering of resources, my highly technical term here. It may be not very educational for those of you who are further advanced, but I'm hoping it would answer some of your questions and pique some interest to delve further. All right, let's move on.
Anything that you wanted to say about this slide?
These are some, sorry, thank you, Felicia. How narrow-minded of me to think about only the Resource Center resources and not those being offered by CSG as well. So these are some CSG resources that you can find through Allison or Felicia, or by going to the CSG Justice Center website as well, which I'm always happy to see associations and organizations who are specifically focusing on women. So there are some additional resources that you can gain through your TA providers and through CSG as well. All right.
Thank you. Yeah, and we also hyperlink them. So if you have the PDF, which was attached to the invite, you can click right on there and it'll take you right to the resource. So thanks, Becky. All right, we're going, in the interest of time, we're going to move right along to voting for the 4-session topic. As you can see here, we have an overview of our upcoming session. So our second session on June 11th will focus, like Allison and Becky have mentioned already, about responding to women's rule-breaking behaviors. So I'm happy we kind of already started discussing that today. Our third session on July 8th will focus on law enforcement and a gender-responsive approach. And as you can see, our fourth session, we wanted to leave open to you all as participants and grant grantees that we provide TA for here at the Justice Center, we wanted to incorporate you in choosing this last session topic to really tailor this learning community to your needs and your interests and goals. So if you can please vote again, we're going to use a Zoom poll to vote on which one option you like the best for our fourth session. If you don't see a topic here listed that you are interested in, feel free to enter it in the chat box, and we'll review those after this session to really tailor our fourth session to you all. So you can take a moment to do that. Thank you. Going to give a couple more seconds, and then we'll close out the poll and see what the result is. Okay, we're going to end the poll now. Yeah, and
Felicia, I was just going to say, I think we're also going to try to take your ideas too, your interests, and even if it isn't the main focus right for the fourth session, we'll try to weave in other ideas for sure as best we can.
Definitely, yeah, exactly. We're not, nothing is really set in stone here. We really want to adapt to you all. Okay, so I was able to receive the results, and we actually have a tie between data collection and sustainability and gender responsive judicial courts and response. So awesome. And the conducting organizational and system assessments wasn't too far behind. So awesome. Thank you guys for being very clear on what you're interested in.
I also saw
what was that, Becky?
I also saw a note in the chat from Alan about interested in any training modules that have worked for other agencies. We have tons and tons of those. So you might ask your TA provider about past webinars that we've done through the CSG Learning Community, for example. We have training modules on the Resource Center website, certainly past webinars that we've done as well. And then NIC actually has an online learning for working with women, so that would be another big resource for you. So there's a lot out there, and then more we can provide once we have a sense of your specific needs.
Thanks, Becky. Sorry, Allison, were you saying something?
Oh, no, I was just going to say, maybe we'll have to have at least 2, if not 3 topics for the fourth session. Or we'll have to work them all. You know?
No, it's great that we have a lot to work with. I think, yes, thank you all. I think it's good to get your feedback and know what you want. So we're here for you.
Yeah.
So fantastic.
We put our heads
so
together.
Again, we'll provide it. Yeah, go ahead, Becky.
Just going to say we'll put our heads together and see how we can respond.
Yes, I was just going to say that. So we'll have an update for you probably by our next session on June 11th with our idea about that, and we can get your feedback. Great. All right, so we're moving towards the end of our session today. I can't believe we covered our very ambitious agenda. Thank you all for being so cooperative and engaging with us. So some things to consider before the next session is this resource for review, which is again tied into our topic about women's behaviors. It's called Gender Responsive Discipline and Sanctions Policy Guide for Women's Facilities. And as you can see, it's hyperlinked here. So if you have the PDF, you can click right on it. I'll also send an update, an email after this session with it attached in case you're unable to access it that way. But Becky wanted to give you a moment here to touch on this resource.
So this is a policy brief that we developed. One of the things we've learned from previous surveys, both by the American Jail Association, the Corrections Association, and Public Policy Institutes in Maine, what criminal justice agencies say is that we really don't have any policies as it relates to gender responsive discipline. So what do? We have no policies for women. The sort of the gender neutral discipline policies that we have don't really work well for women, or we end up treating women more harshly because we interpret their behaviors differently than for men. So we created a discipline guide, which we've been working with several states on. And again, this is one of those things, it's very narrowly written for women's correctional facilities, prisons and jails. And it's a lengthy document, so I'm going to suggest you only look at section 3, which is a lot shorter, less than 20 pages. Like sort of 10 principles, which I think, again, if you substitute mental health court, human trafficking court, crisis intervention, and where it talks about violations, that you might think about infractions and rule-breaking behaviors. So, so we want to kind of talk a little bit about that, and I think we might have like 5 minutes maybe. If anybody has any quick guidance about what do you see? I mean, how are you responding to women that break the rules? They abscond, they don't show up for court, they don't go to treatment. They may be acting out on the street if you're called out for a crisis. What do you want to learn about here, and what are you observing? Just quickly, if anybody has a comment. None of your women break any rules whatsoever. It would be fabulous.
How excellent.
All right, well, we're going to send you either a poll or some questions ahead of time because we really want these sessions to be helpful to you as you plan and implement your programs. So all of you are having to deal with rule-breaking behaviors of some kind, I'm sure. And again, I use that in a very generic way. Women who are not compliant, women who are not showing up, women who don't stay in services that you refer them to. You don't want to drive them 3 hours to the residential program. So how do we keep them in the community and respond when they may not be so willing? So that's kind of our topic for the next round. I refer you to section 3 of the discipline guide, the hyperlinks here. If you are anxious to look at it, you could, again, just go to the Resource Center website at cjinvolvedwomen.org and look at project resources until you find the discipline guide. If you are extra ambitious and you really want to read kind of all of the research, because this is evidence-based, want to read all the research, you can go to the appendix where we have all the research that's sort of underlying the guide and the ways in which we talk about responding to women's behavior. So that's what I'll say about the second session.
Thank you so much, Becky. Last chance if anyone has anything they want to add or a question they may have about that topic before our next session. We do have a couple minutes. Okay, so this is just a detailed bibliography here about the resources that we mentioned earlier on slides 24 and 25. And here's our contact information. Feel free to reach out to us in between sessions with any questions that you may have about gender responsive services or any resources that you're looking for, or any way that we can be of assistance. Feel free to contact us.
And the slide deck is in the invite, right, Felicia? So people can look back at the slide. Hyperlink.
Yes.
Okay, great.
Yes, it's a PDF, so it's great. It has everything, all the links work, hopefully. If they don't, please feel free to reach out and let me know. I'll find the right link for you all. And we just wanted to say thank you. And another reminder that we did record today's session. We only recorded the slides and the audio portion, so no video, personal video was recorded today. and we'll have this ready to you by the end of next week. Take care, everyone. We're going to sign off now, and we'll see you on June 11th.
Thank you.
Thanks, everybody. Thanks, everybody. Take care.
Thank
Bye.
you. You too.